Hi everyone, welcome to PalliPulse, where palliative care is, just simplified. My name is Dr. Mona Tareen, and I'm your virtual palliative medicine physician, and I'm here to actually clear up some myths and taboos. So I first wanted to start off by saying I've heard people often say, I don't need a palliative doctor, I'm not dying. And so actually this is one of the biggest myths. Palliative care isn't only for those that are at end of life. It's for anyone with a serious illness who needs help with their pain, their symptoms, or even making complex medical decisions. So really, you don't have to be in your final days or weeks to benefit from a palliative medicine consult. Another myth that I've heard and been told quite often is, I don't want morphine. Morphine is only for those who are dying. And this is not true at all. Morphine in palliative care is used to relieve distressing symptoms like pain, breathlessness, or even anxiety, although our first line are other medications. But it's typically used at any stage of a serious illness. And this is an age-old taboo, and it no longer reflects in modern medicine. Another question that I get is, if someone chooses hospice, do they lose their primary care physician? And the answer to this, or rather the correct answer, is hospice is all about adding support and not taking it away. So Medicare and most insurance plans still cover your primary care visits. And if you see your doctor for conditions that are not related to the hospice diagnosis, like management of your hypertension and diabetes, that's billed through Medicare Part B. And if it's hospice related, the visit is covered by the hospice program, but you really have to give them a heads up before you go. So your primary doctor can stay involved, either as your hospice attending or separately for non-hospice care. And the last question that comes to my mind in terms of myth is, what if a patient prefers medical cannabis instead of morphine? Does hospice cover that? And that's a good question. Hospice programs usually don't cover cannabis, and many hospice physicians actually don't have experience in adjusting it. So the best rule of thumb is, if anyone who is on medical cannabis, you start low and you go slow, but always remember that medical cannabis can interact with a number of your medications. So always talk to a qualified clinician first. So thank you for listening. For more insights, visit PalliPulse.org or follow us, where we make palliative care simplified.